all, some of you were here for last week. Some of you were not here for last week. It's not a problem. This is basically designed to be a series, but to also be able to be very usable as freestanding content. We're very, very honored and thrilled tonight to have Dr. Monica Garrick here with us. She is an expert in advanced care planning. She's an assistant professor of bioethics at Case Western Reserve University in Cleveland, Ohio, and is also the co-director of the Center of Biomedical Ethics at Metro Health, which is also in Cleveland for those of you who are not from the area. And we agreed to when I started, we weren't going to do a big intro. I'm going to let her get right to the meat and the potatoes and turn it over to Dr. Garrick.
All right, great. Thanks, Molly. And again, feel free to interrupt. If it seems like the question's going to have a long answer, we may delay it until the end. I'm going to try to get through everything that I have here for you in about 30 minutes. And that way we'll leave lots of time for questions if you do have them. And again, you can either put them in the chat or raise your hand or, just shout out if you have something as we go through this. So I just wanted to wish you all a happy second day after Healthcare Decision Day, since it was on Sunday. It's April 16th. And I also want to tell you, this is standard for those of you not familiar with academic medical professional talks, that we have to tell you that we have nothing to disclose. And I want to also be clear that these are not legal recommendations because I am not a lawyer. My lawyer colleagues will probably tell me I know enough to be dangerous. Just like my medical colleagues will say, I know enough medicine to be dangerous, but these are ethical recommendations based on 15 years of doing clinical ethics consults at hospital systems in the Cleveland, Akron region up here. So these are just things that I learned that I think are helpful to families and patients as they navigate not just end-of-life care, but any medical illness. Okay, so I want to make clear as we start off that we'll be talking about advanced directives there on the left side of the screen, your healthcare power of attorney, the declaration for mental health treatment and living will, organ donation, and then I have in italics here the disposition of body, because there's some discussion about whether or not it's actually an advanced directive or not. We're going to talk about it just because I think it's good to do so. On the other side, you see the medical orders, which is a do not resuscitate order, and it is not an advanced directive. We will talk about it so that you have some understanding of it, because I think it's worth including, but it is really important to note that it itself is not an advanced directive. It's a medical order. But first, I want to mention guardians, because they are also not advanced directives. And again, I'm happy to answer questions about these. A guardian is assigned to somebody through the probate court when that individual is determined to no longer have the ability to make certain kinds of decisions for themselves. So it usually relates to healthcare decisions or personal decisions or financial decisions. And what happens is there's concern that this person can no longer do this, whether it's because of a traumatic brain injury, whether it might be because of dementia, it might be because of a psychiatric condition. And someone will decide that they need to help this person manage their lives. So the first step in this is to get a physician or a clinical psychologist to complete what's called a statement of expert evaluation. That form is filed with the probate court. The probate court will now notify all of the next of kin, which is part of the application form, is that you have to include next of kin. The court will then do an investigation, which will include sending a letter to the patient or individual. They will also meet with the individual to help assess their ability to participate in their own decisions. The individual has a right to contest the filing and can get legal assistance to do so. And then, as I noted earlier, if they are deemed to need help in making decisions regarding like their healthcare or their finances, then the court will assign them a guardian. The purpose of the guardian is to help the person be as autonomous as possible while also having the legal right to assist them in these decisions, right? So this is something that has to go through a court. You can, and we'll talk about this in just 1 minute, Indicate on your healthcare power of attorney form who you would like to be your guardian if you need one, but this is not a decision you make. This is a decision that the court makes. All right. So your healthcare power of attorney form is the form that allows you to name a proxy or a surrogate to speak to your medical providers on your behalf if in fact you do not have the ability to do so yourself. Again, this is not just for end-of-life decisions. This is for any kind of decision that may need to be made about your medical care in the event that there is some reason you can't participate. So if you're sedated and you can't participate, or perhaps you've been knocked unconscious and you can't participate, if you may be talking to people, but you may not have the capacity to participate because you're confused because of medication you're on or because the illness that you have. So this is somebody that you say to people, I trust this person to be my voice if I can't be my own voice. And then this person's role is to speak to your providers and to convey your wishes regarding your medical care. And it could be about, breathing machines. It could be about feeding tubes. It could be about dialysis. It could be about chemotherapy or radiation or blood transfusions or anything of the like. So this is somebody that will do that on your behalf again, even if it's temporarily, cannot participate in your own medical decisions. As I noted a second ago, you'll be able to suggest your own guardian on that form if in fact you may need one in the future. And this is different from a financial power of attorney. So this is a really important thing to note because we get a lot of confusion in the hospitals about, quote, power of attorney. So that is a term that is thrown around and people get confused about what it means. There's the healthcare power of attorney, and then there's the durable power of attorney for finances. And you can designate two different people to serve in those roles. You do not have to designate the same person to serve in those roles. And often what happens is that somebody will designate a financial power of attorney. They will not designate a healthcare power of attorney. So the financial power of attorney will show up to the hospital and say, I'm their power of attorney. We'll look at the document. We'll tell them, unfortunately, this doesn't hold weight in this situation. And then we have to go, I'll share briefly, we'll have to go to the next of kin hierarchy. All right, so make sure that if you're completing these forms, that you're clear about what form you're completing and who you want to serve in which role. We will often see patients who may have a nurse or a physician or a physical therapist, respiratory therapist, or somebody in the medical field serve as their healthcare power of attorney. And then some people will choose, if they have a child who's an accountant or somebody who's good with numbers or something, they'll choose that child to serve as their financial power of attorney, right? So you don't have to designate the same person. It doesn't really matter if you, for our purposes, if you designate the same person. What matters is that the people know what role that they have. And so there's no confusion if you get sick and are not able to participate in your own decisions. All right. Good so far? Okay. So if you have not completed a healthcare power of attorney, and if you don't have a legal guardian, then this is who we turn to in this order if you can't participate in your own medical decisions. This is for adults. So if you have a spouse, we will turn to your spouse. If you do not have a spouse, then we will seek the majority of your adult children. If you do not have adult children, we will contact your parents. If you do not have parents, we will try to contact the majority of your adult siblings. And if you don't have any of those, then we will reach out to the nearest relative by blood or adoption. So pay close attention to this list. I always tell people, because if you don't like it, then you should complete a healthcare power of attorney, because we will go to great lengths to find these people, even if you are estranged from them, because the law tells us we have to. So even if you haven't talked to your children in 25 years, if you're not married and you haven't talked to your children in 25 years, we have to, according to the law, make a reasonable attempt to contact them. And so we will reach out and try to contact them, even if they don't know what your wishes are, right? So if you do not like this list makes you uncomfortable, then please complete your healthcare power of attorney form. Something else to note is that in the state of Ohio, if you have separated from your spouse, but you haven't filed for legal separation. So you've moved apart, and this could be 5 years ago, 10 years ago. We've had them 25 years ago, but you never filed for legal separation. They are still your spouse. And that is the person we are going to have to turn to first. So again, if you have a healthcare power of attorney form, that will trump your spouse. Right. So I want to be clear about this. Your healthcare power of attorney form will trump this next of kin hierarchy if you have it. But if you don't have the healthcare power of attorney form, or you don't have a guardian, then we're going to turn to this list. Something else to note is that your healthcare power of attorney may choose not to participate in your medical care if they don't want to. They're not obligated to do so. They can decline. And there is a place on the form for alternates. So if the healthcare power of attorney declines to participate, then we will go to the alternates in the order that they're listed. If everybody declines, then we're going to go to the next of kin hierarchy. Now, each person on your next of kin hierarchy can also decline, but nobody's allowed to defer to the person of their choosing. So they only have the power to participate in your healthcare. They do not have the power to defer to somebody else to participate in your healthcare. So let's say Lisa has named me as her healthcare power of attorney, and let's say I'm uncomfortable for whatever reason participating. And so I say, I don't want to do this. I can't then say, I want Molly to do it since I don't want to. If Lisa has named somebody else on her form, they have to go to that person next. So if Molly's my spouse and Molly says, I'm upset, I don't think I can handle these decisions, I want you to go to her friend Lisa, the medical team is going to say, sorry, we can't do that. We have to track down Monica's adult children, and they're going to have to be the ones to participate. All right, so you want to be careful about that, that the person who is next in line doesn't get to choose their replacement if for some reason they don't want to participate or they're not available to participate. All right, we're good so far? Okay. So this is a form that not a lot of people know about or talk about, but it is a really important form. It's the Declaration for Mental Health Treatment. So this is a form that allows you to do a similar thing to a healthcare power of attorney. It allows you to name someone to speak on your behalf for your mental health issues if you can't do so. But it is a much more comprehensive document than the healthcare power of attorney form, because it already also allows you to share your wishes regarding medical providers and facilities. So if you have a preference for a doctor that you would like to have treat you, if you need mental health care, then we will prioritize going to that physician. If there's a facility you prefer to go to, then we'll prioritize taking you to that facility. If there are physicians or other providers that you feel just very uncomfortable having treat you, then we should do everything in our power to avoid having those people treat you. If there's a facility that you're uncomfortable going to, we should do everything in our power to avoid taking you to that facility if you've named it on there. All that being said, if we are limited in options, then we have to take you to where you can get good care, whether it's someplace you would really want to go or not, right? Because we have to treat you. So treating you trumps not treating you, but we will try to respect your wishes if need be. You can also share your wishes regarding medications and therapy. So if there's a medication you've been on before that didn't sit well with you, that caused you problems, that you had an allergic reaction to, or you had a medical reaction to of some other sort, then you should list it on there so we know to try to avoid it. Again, if it's just a matter of like, well, I don't like that medication, if the physicians think it's truly in your best interest to have it, then they can trump that document, but they should do everything in their power to avoid overruling your wishes in this case. But you can also indicate your wishes, including electroconvulsive therapy. And if you're going to do anything on this form, I would highly recommend you do two things. One, name your proxy, and two, name your wishes regarding electroconvulsive therapy, because these are the two places where it's really going to matter that you voiced your opinion over something. We have psychiatrists who are very uneasy providing certain kinds of treatments to patients with psychiatric illnesses. if we don't know their wishes, just because of the history of psychiatric treatment in the United States. And so it can be very difficult to get you the care that you want and need if we don't know what your wishes are, just because of the hesitancy on behalf of the psychiatric providers. A couple other things to note is it's the only document we have that allows you to name who you would like to care for your pets if you are hospitalized for a period of time. This form, unlike any of the others, needs to be updated every 3 years. So you'll want to keep track of that. And this is the only form that needs to be signed by the person you're naming as your proxy. So you can complete your healthcare power of attorney form and name the person that you want to serve as your surrogate, and you never have to tell them. Now, highly advise against that. I'm actually going to encourage you to tell them, but they don't actually need to know, and they don't have to sign the document. In the Declaration for Mental Health Treatment, the person you name as your surrogate has to acknowledge that you've named them as your surrogate.
Monica, somebody asked a question, and I think it's going to be specific to this particular document. So somebody asked, does this include dementia?
No. You know what else it doesn't include? It also doesn't include those with substance use disorders, which I'm working actually with a former master's student now, a first-year medical student at another institution on this to make an argument that, you know what, I should bring up the dementia case with her. I'm going to make a note that it should be used for patients with substance use disorder, since the DSM-5 classifies substance use disorders as a psychiatric illness. So we think it should cover people with substance use disorders, which would mean that we might be able to treat them against their wishes in order to help them. That gets really complicated, as you can imagine. But dementia is a good question. I appreciate that question, Jan. But currently, no, it doesn't. It doesn't cover people with dementia. But what's really great, so if you have these kinds of wishes and you're concerned that you've been diagnosed with dementia, or you're concerned that you will be diagnosed with dementia at some point, there is a space on the healthcare power of attorney form. I don't know if you have a copy or you're able to open it. There is a space on the healthcare power of attorney form that will allow you to share your wishes regarding things. And you should certainly put these kinds of things there. You know, if there are certain medications you don't want if you have dementia, or there's certain kinds of treatment you don't want if you have dementia, you can certainly list them in that space that's allotted for that on the healthcare power of attorney form. And look, I always tell people too, I had a question recently by someone else. I can't remember where it was or what the question was about designating wishes. And I'm like, look, if there isn't space in the document, then type it up or write it up on another piece of paper and have it witnessed, and then attach it to the document. Is that technically legally binding? I don't know. I can't give legal advice, but what I will tell you as an ethicist, that anytime we have any expression of a patient's wishes, then we use that to help direct medical care. So any place or any way that you can convey what your wishes are, whether it's talking to your healthcare power of attorney or other surrogate or proxy, whether it's documenting it on the healthcare power of attorney form, whether it's documenting it in a declaration for mental health treatment, whether it's just typing it up on a piece of paper and stapling it to a copy, then again, any way you can convey those wishes are very useful. We will sometimes use a living will, even if it's not relevant in a particular situation, to help us better understand a patient's wishes. We'll sometimes go back through their medical chart and see what kinds of treatment that they accepted or declined, over time. And if there was a consistency about the types of things that they would accept and decline, in order to help us determine, medical care. So yes, Bill, that's what I'm referring to. So Bill, just for those of you not able to see the chat, so are you referring to the additional instructions on page 5? Yes. For where to include, other types of things such as treatments and medications and providers. That's exactly where you should put it.
Monica, real quickly, we do often mention that there are a couple of dementia provision documents that are made up, one in Washington State, one in New York State. Again, we always advise that we don't know that they're legally binding, but it's a good way of going through a document that really does explore some of the things that you may want Oh, and it looks like Molly's putting those in the chat now. So just wanted to point that out too.
Right, and this brings up a good point. So if you happen, like, so I think most, if not all of you are in Ohio now, but maybe not, right? But if, say, you move to New York or you move to Michigan or somewhere, and you're back here visiting, and you end up in the hospital and your advanced directives are from New York, the hospital here in Ohio ought to respect those. Right? They're not technically Ohio documents, but it is an expression of your wishes, right? I mean, you've said in these documents what you want or who you want, and those ought to be respected. So in the hospitals I've worked at, and I've worked at every hospital in the Cleveland, Akron area, except for the VA, pretty much, and every hospital is going to respect those documents, at least in the Cleveland area. And I would assume it's the same way at other hospitals in Ohio, and it should be the same way in every other state in Ohio. And I will tell you that if that's not happening for you or your loved one, then ask for an ethics consult, or ask for their legal team to get involved, or ask for their patient experience team to get involved, or ask for their ombudsman to get involved. Right? Because again, they are an expression of your wishes. So Lisa, to your point, if you complete these forms, and Ohio technically doesn't have them or recognize them, still complete them and put them with the rest of your documents so that they can be shared and we will know what your wishes are. There are some, and I didn't include it in here, I thought I had it at one point. There are some religions within the country that also have specific advanced directives for them. So Jehovah's Witnesses have their own, Christian Scientists have their own. And technically, again, they're not the Ohio forms, but we are going to respect them if we can, depending on the circumstances, right? Because they are an expression of your wishes. And we want to respect your wishes. If you've taken the time to tell us what they are, you've taken the time to tell the surrogate what they are. And yeah, I did tell, oh, thanks, Molly, already answered that question. Okay. You will get a printout of the slides for those of you who can't see the chat. Right. So any way, shape, or form you share your wishes, but documenting them beats everything. Because if, I'm going to tell you at the end, please talk to your surrogate, please talk to your surrogate, please talk to your surrogate. But sometimes what can happen, unfortunately, is people get sick and then family and loved ones end up at the bedside. And this person will say, oh, I talked to her yesterday and she didn't want this. And this person said, well, I talked to her 5 minutes before this happened and she said she wanted this, and then what are we going to do? Right. And then we have to try to sort it out. So the more information you can provide, the better. And the more people you talk to, the better, so that there is a consistent story. And if you can be consistent, look, it's hard to be consistent. And we don't always know what we're going to want when we're in a particular situation. So I'll note at the end, like sometimes it's not about particular treatments, it's about the quality of life or the things you want to be able to do. That might be what helps to guide your medical care. Yeah. Okay, so your living will literally only does a couple of things. It only tells us what you want, primarily about nutrition and respiration, but along with nutrition and respiration, we also often include hydration. So it's only a document for you to share your wishes with us about ventilators, what we might call breathing machines, right, or feeding tubes, and only in a couple of very specific situations, right? It is only if you are incapacitated, so meaning you cannot talk to us and convey your wishes on your own, and you're terminally ill, or if you're in a permanently unconscious state. It's the only things the living will addresses are artificial nutrition, hydration, and respiration, and only if you are incapacitated and terminally ill or in a permanently unconscious state. So this document is not going to come into play if, say, you're dehydrated and currently, currently a little loopy because you're dehydrated. This document's not going to come into play here, right? This document's not going to come into play if you have cancer and are terminally ill, if you're able to participate in your own medical decisions. So as long as you're able to participate in your own medical decisions, none of these documents matter, right? What matters these documents matter only if you're unable to participate on your own. Yeah, so this is a very limited document. So if you want artificial nutrition, hydration, or respiration, don't even think about this form, because the only thing this form is going to allow you to do is say, no, I don't want these things. So there's no reason to complete this form if you want these things. Yeah. But if you don't want these things, this is in these two situations, then complete the form. Yeah. Right. So your organ donation form, it's a very thorough form. And it can be, it's more complicated than the BMV. Right? So I'm gonna just go here. So at the BMV, when you check that box, you're agreeing to donating everything for every reason, right? That's what that box means. And I know that they don't explain that to you, and maybe we need to come up with a better process for that, but that is basically what you're doing. When you check that box at the BMV, you are saying, I will give every organ for every reason. The organ donation form allows you to be more specific. So the organ donation form allows you to share your wishes regarding donation for transplantation to somebody who needs it, therapy if somebody needs it, research, and education. And you can share your wishes regarding all of these organs and other bodily samples on the right-hand side of the page. So if you do not want your body donated to science, then you should complete the organ donation form. If you are willing to have your body go anywhere for any reason, then the BMV is fine. It's a little concerning, I know, to some people, because they don't really realize what they're signing up for when they check that box at the BMV. Yeah, so April is organ donation month, in case you didn't know. So it's not only National Healthcare Decision Day, but it's also organ donation month. But I know that this can be a touchy subject, and it's good to think about what types of things you're willing to donate and what types of things you're not willing to donate, and to complete the form. Yeah. Okay. So if you don't have an organ donation form, or you haven't designated on your BMV that you want to be an organ donor, this is the next of kin hierarchy. And you can see that it's similar, but yet a bit different than the next of kin hierarchy for just medical decisions. So we will turn to your spouse, your adult children, your parents, your adult siblings, your adult grandchildren, your grandparents, any adult who exhibited special care for you, and any adult who has the right of disposition of body. Now, if there's a conflict between your adult children or your adult siblings, then the law tells us we have to go with the majority of those adult siblings or adult children. Questions about this? No? Okay. So for the advanced directives we talked about so far, give copies to the people that you trust. Do not put them, I joke, people on here who have heard me give this talk 100 times know that I will say this, do not put them in a safety deposit box in a bank, because we are going to need it at 2 a.m. on Sunday morning, and then we're not going to have it, right? So that is the worst place to put it, is in a safety deposit box somewhere. You should give copies to people you trust. You should give copies to your medical providers. You should bring copies with you to the hospital. If your hospital has MyChart, you can upload them to MyChart now. And remember to share copies if you update them. And it's really important that the people who are going to be in your life when you're sick have copies of these, or know where to find the copies of these, right? That they are readily available and they can get them quickly. And if you update them, please share them. If you update them, so if you've given a copy to your doctor and then you update it and you don't give a copy to your doctor, technically the first one is the one that is legally binding, not the second one. So if you do update them, make sure you give a copy to any doctor you've previously given a copy to. And these are really easy to update. You know, I know that Molly sent the links And you can see on there somewhere in a slide here, we'll see shortly, you do not need a lawyer to complete these. You don't need a notary public to complete these. You just need 2 witnesses who meet the criteria for each of the forms. And so, you know, if we were all in a room together, we could have brought copies and we could have filled them out. We could have had each other sign them and they would be legally binding. And if you change your mind tomorrow, you can rip it up, throw it away and complete a new one and just get your neighbors to sign them. Right. And because all the witnesses are doing are verifying that you had the capacity to complete the documents when they witnessed it. There we go. Yeah, so you don't need to spend hundreds of dollars going to a lawyer. And it's not that I don't trust lawyers. There are some really, really good lawyers out there. I know some. A lot of the lawyers that you're going to talk to about these documents have never been at the bedside when things go wrong. And some lawyers, I think because they feel they're charging you money, that they will create their own documents. And sometimes those documents can cause real problems at the bedside. So we've seen lawyers create their own versions of these, and they will allow somebody to name 2 healthcare power of attorney proxies. And then, of course, what happens when they get to the bedside is that both of these people disagree with each other. And now, you know, what do we do? Because the lawyers allowed you to name 2 people. And we're at an impasse. So it's best to use the Ohio copies, and it's best to talk to people who are going to be in your life about these. And I will tell you, if you want to talk to good people about this, to get good advice about this, it'll be the ethicists at your local hospitals. Likely your social workers are really, really knowledgeable about these. And so you can also ask a social worker at your hospital. Which POA, are you talking about the healthcare power of attorney? So the question in the box is, does the POA expire upon death? And I'm taking it, you're thinking about the healthcare power of attorney. It does. So as soon as you die, and I'm going to get to that, to what happens to your body when you die. Yes. So your healthcare power of attorney is no longer your surrogate once you are dead. That role moves. Either if you've completed out of a disposition of body form, that it will move to the agent you named in there. If you haven't completed a disposition of body form, then there's a next of kin hierarchy for that, which I'll share with you shortly. But yes, if as soon as you're dead, that healthcare power of attorney no longer is your surrogate. So dementia. So dementia can be, so I'm not a doctor, so you would want to talk to a doctor about this, but in my experience in the hospital, people have been deemed terminally ill with a dementia diagnosis. If it's an advanced dementia, and they expect so terminal generally means they expect you to die within 6 months or less. And if you have an advanced dementia diagnosis, then they may actually indicate that you will die within 6 months or less. My mom had a terminal dementia diagnosis at one point, and I mean that was the only thing that was wrong with her was she had Lewy body, and they at some point we got to a point where they said we expect her within 6 months and we can enroll her in hospice then. So it can be a terminal diagnosis, yes. All right. So here's the disposition of body information. So it does allow you to name a successor to oversee the disposition of your body upon your death. And it allows you to share your wishes regarding your funeral, memorial services, religious observances, etc. Yeah, so anything that you would like to have done to or with your body, the exception of organ donation upon your death. Right. So this all gets very complicated because you have your healthcare power of attorney for if you don't have capacity and you have medical decisions that need to be made, including withholding and withdrawing treatment. And then you can, if you want, well, so then you have your organ donation form. And if you haven't, so there is a next of kin hierarchy for organ donation that we can follow if you haven't completed your organ donation form, right? So if you haven't completed it, then we have the next of kin hierarchy. If you've completed your healthcare, your organ donation form, or checked the box at the BMV, that is legally binding. And technically, nobody is allowed to overrule that. If you've said, I want my body to be donated, I want my organs to be donated, technically, that is legally binding, and nobody is supposed to be able to revoke that. With that being said, there are some organ procurement organizations who find it difficult when you have a patient who has said they want to donate their organs and you have family at the bedside very upset at this idea. And then sometimes the organ procurement organization won't push the issue. So just so you know, this has nothing to do with the hospital. So once you're determined to be brain dead, or once they think that you may die from circulatory death, then they contact an organ procurement organization to come in and talk to your family about the situation and discuss. They know if you've checked the box at the BMV, they know if you've completed the form. If you have, those wishes are supposed to be respected. If you haven't, then they'll go to that next of kin hierarchy to decide whether or not your organs should be donated. If you've said yes, they're supposed to respect it. But again, sometimes families get really upset, and some organ procurement organizations just don't want to back the family into a corner. So if you do want to donate your organs, I highly recommend you complete that form. And you make it very clear to everybody you know that these are your wishes and they are not to be rescinded, that they ought to be respected. So you should tell your physicians, you should tell your healthcare power of attorney, you should tell the person overseeing the disposition of your body, you should tell, write it on the healthcare power of attorney form as well, because that will just help people respect your wishes. Because you can understand that it can be very emotionally fraught when you have somebody who wants to donate their organs and you have family who is just beside themselves that they're in this situation with their loved one. This happens not always, but because often when it's a young person, the family is really likely to donate organs if the person hasn't indicated, because they want some good to come out of a really bad situation. But we've had some young people who had taken the step to donate their organs and their families were just very, very emotionally upset by this idea. And then it can become a very difficult situation for everybody. But you can name some, so you've got your healthcare power of attorney, you've got your organ donation stuff, and then you have your disposition of body stuff. And the person who oversees the disposition of body is not necessarily the person who oversees your organ donation. because why make it easy, right? Why make it easy? So if you don't fill out the disposition of body form, here is the hierarchy, which these are all similar, but there are some minor differences when we get to next available relative or grandparents or grandchildren, right? So it would be your spouse, your adult children collectively, and not majority of your parents, your siblings, your grandparents, your grandchildren, lineal descendants of the decedent's grandparents, which I find a little odd, but okay. If you had a guardian, then it would be the guardian. And if there's no guardian, then any other person willing to assume the responsibilities. Yeah, so if you're somebody who has a tendency to be a bit of a loner and not interact with your families very much, then, we are still going to make a reasonable effort to contact your next of kin. So if you do have ideas about who you want to have this responsibility, again, I encourage you to fill out this form. And it doesn't have to be the same as your healthcare power of attorney. It doesn't have to be the same as your financial power of attorney, right? It doesn't have to be the same person you name as the proxy in your declaration for mental health treatment. It's the person you think who's going to respect your wishes upon your death about, the types of things you want done after you're gone. Yeah. Okay, any questions sort of up to this point? But we can come back. Yeah. All right, so do not resuscitate orders. Again, these are not advanced directives. These are medical orders. They have to be signed by a physician, an advanced practice nurse, or a physician's assistant. You cannot complete these on your own behalf. You have to have a conversation and have it signed by one of these medical professionals. Yeah. But once you've agreed to it, or your surrogate has agreed to it on your behalf, you can revoke it at any time. So you can change your mind. You have the right to change your mind. If at some point you say, I don't want resuscitation attempted in these certain situations, which I'll talk about briefly, you can go back and say, nah, I actually do want you to attempt it if it's appropriate. Yeah. But if you agree to it, and then you get into a situation where you lack capacity, your surrogate technically does not have the authority to revoke it. They can only revoke it if there's good, very good reason to believe you would revoke it in light of new information. Right? So once you've signed it, it should be binding, and it's not a legal document, it's a medical order, but it should be an order that stays in place unless new information comes to light and people are convinced that you would revoke it on your own behalf if you could. But that bar is pretty high, or it should be pretty high, what is actually happening in hospitals, right? But the bar should actually be pretty high. Because again, it's a decision you made, right? It's a decision you made, and we should respect your decisions if you make them. Yes, if you ask for a DNR while you're conscious, so Martha, it can be revoked. So this is the question. If I ask for a DNR while conscious, it can't be revoked. It can, but the bar should be really, really high. Right. So again, I can't guarantee that every provider in every hospital is not going to give in to a surrogate who's begging them to revoke a DNR order, but it really ought not to be revoked. And Jan is asking, what if I want a DNR only if I'm terminal and close to death? It's the same thing. So, you know, I was talking about DNRs to a group of residents a few years ago, and there was like a 23-year-old resident, and she raised that. She's like, well, how do I get a DNR? And I looked at her and I said, are you healthy? And she said, I don't want you to share your medical information if you're not comfortable, but you appear healthy. Are you healthy? She goes, yeah. I said, no doctor in their right mind should complete a DNR order for a 23-year-old who's otherwise healthy, right? So these documents, these orders really ought to only be for people for whom attempting resuscitation would either not be successful or would do more harm than good, even if they are, quote, successful, unquote. Right. So if you are terminally ill and close to death, then that's the perfect time for a DNR order. And one would hope, again, that people would respect your wishes. And I'm going to argue they ought to respect your wishes. I just can't guarantee that they will. Right. So let's get to the two kinds that there are in the state of Ohio. So these are the only two types of DNR orders in the state of Ohio. Now, depending on what hospital you go to, they may have different versions of these because hospitals like to do this. But these are the only two only two DNR orders you can have that are what we call portable, that you can leave the hospital with. So you may have a different kind of DNR order in a hospital. The big one is a DNR CCA with intubation, and I'll talk about that in a minute. That's the big one that a lot of hospitals have. That is technically not an Ohio DNR order, but you can't leave the hospital with that order technically because it's not a portable DNR order, right? Meaning, again, it's not a valid DNR order, because to be a valid DNR order, it has to be one of these two. And there can be no other writing on that order other than you checking the boxes and signing it. If there's any other writing on that order, it's technically invalid. Yeah. Okay. So we'll start with the DNR-CC. So Jan, to your question, this would be the type of order that you would want if you're terminally ill and close to death. You would want what we call the DNR comfort care order, right? And what this means is that it's been determined that continuing life-sustaining treatments is no longer appropriate, that the focus of care should be transitioned to comfort. So we're only going to keep those measures in place, the primary purpose of which is comfort. We're going to stop all of the treatments, the primary purpose of which is life-sustaining. And if you suffer a respiratory or cardiac arrest, nobody's going to do anything, right? So these are the orders for people who, Jan, to your point again, is if you're terminally ill and close to death, right? These are for who are in hospice or for whom the focus is on palliative care. Little sidebar about palliative care. It's not just for end of life, right? Good palliative care doctors help manage your symptoms through lots of illnesses. So please don't freak out if somebody says we want to get you a palliative care consult. That could be a very good thing. I joke with my doctor that I would like to have a palliative care doctor now, even though I'm relatively healthy and I'm not in pain from anything, but I just want one on my side. So please, if somebody recommends a palliative care consult, don't think it's because necessarily you're dying. You might be very, very sick, but it doesn't necessarily mean you're dying. If somebody starts talking to you about hospice, now that means that they think that you are terminally ill with likely 6 months or less to live, right? So the DNRCC order will be for those people who are at the end of life. Yeah. The DNR-CCA, which is the DNR Comfort Care Arrest Order, means that we can continue to provide all kinds of life-sustaining treatments to you. So if you're on a breathing machine, we can leave you on the breathing machine. If you have a feeding tube, we can keep the feeding tube in. If you're getting chemotherapy, you can continue to get chemotherapy. We can give you blood transfusions. You can be on blood pressure medication. You can get the whole gamut of things up until the point that you suffer a cardiac or respiratory arrest. And if you suffer a cardiac or respiratory arrest, then we're going to switch the focus to comfort. And we're going to stop providing medical interventions that are in place primarily to sustain your life. And we're going to just rely on those treatments, the primary focus of which is comfort. So the only difference between these two orders is the point of implementation. It's the only difference between the two. If you're writing a DNR Comfort Care order, it's going to be implemented now, and we're going to transition from life-sustaining to comfort. If you have a DNR Comfort Care Arrest order, we can continue everything, all life-sustaining treatments, again, up until that point where you suffer some sort of arrest. Then we're going to transition to comfort only. Yeah. So this DNR-CCA with intubation is like the little hiccup that a lot of hospitals like to have, because this is from the pulmonologist. If somebody has COPD, there's a lot of conversation about whether they're decompensating or whether they're actually arresting, and at what point we can intervene and what point we can put them on a ventilator. And so they have these little extra DNR orders that they can do in a hospital. And you can talk about that with your provider. I'm not saying they're bad. They can just make things pretty complicated. And there are some hospitals that, one in particular used to have, they've updated recently. They used to have sort of like a smorgasbord where it's like, I have a DNR order, but I want dialysis. I have a DNR order, but I want this DNR order, but I want the other thing. Most hospitals are moving away from that just because it makes things really hard. Yeah. So again, this is the DNR-CC is if the focus is going to be on comfort and not on sustaining your life. This is if we're going to continue to try to sustain your life, but in the event you suffer an arrest, we're going to focus on comfort. Yeah. Okay, so what's most important? Naming a surrogate. Like, this is what I think is one of, if you don't want to go down, there's a lot of information. There's a lot of stuff to keep in mind. I get it. But what do you want to do? You want to name a surrogate. You want to complete that healthcare power of attorney form. If you do nothing else, complete that healthcare power of attorney form and talk to them. Talk to them about whether quality of life matters to you, whether quantity of life matters to you. What things do you think you absolutely can't live without being able to do? But as I say that, let me tell you that a lot of people adjust to a lot of really complicated situations. And we don't always know what we're going to want in a situation that we find ourselves in. So one of the, there's been a lot of people say, well, the one thing I know I don't want is I don't want to live my life in a wheelchair attached to a breathing machine, right? I don't want to have quadriplegia. I want to be able to be mobile. And if I'm not mobile and I can't take care of myself, I don't want to live. And I can tell you that the studies show time and again that people who were able-bodied and are now have quadriplegia have as good as, if not better, quality of life than they did before they were injured. So while we might think we know what we want, we don't always know what we want. And we have had patients who have changed their minds. We have patients who have said, I want you to do everything. I don't want to die. Do whatever you have to do. And then when they get close to death, they're like, no, I don't want any of this anymore. I'm done. And then we have people who say, don't do anything. Let me die. Leave me alone. And then when they get close to death, they're like, no, I want you to do everything for me. Right. So people, you may change your mind. So as you're having these conversations, think about really what deeply, deeply matters to you, not, well, I can't be in pain for 24 hours or more. If I'm in pain for 20, then that's it, right? Like, maybe that's true. I don't want to say it's not true for you, right? But is it really true? Like, you want to think, is this really, really true for me, that I really cannot live in pain for more than 24 hours? So you want to think about those things that are like deeply, deeply matter to you when you're thinking about these kinds of things, because you could change your mind. Yeah. So it's not really about the treatment option. So people say, one of the big things, I'll throw this 2 cents in there. We have people who say, never want to be on a breathing machine. I never, ever, ever want to be on a breathing machine. I don't want to be on a ventilator. I don't want to do that. And what a lot of people don't know is that we often put people on ventilators for very short periods of time. That just because someone's putting you on a ventilator does not mean you're going to be on it for the rest of your life. If you have a pneumonia or something, they may need to put you on a ventilator for like 24, 48 hours, 5 days or something. And then the plan is to withdraw and the ventilator and let you breathe on your own, or put you on a CPAP machine, right? Temporarily, right? So you don't want to say, I never want this, because this might be temporary, right? So you want to think, do I not want it long-term? Do I not want it temporarily, right? Maybe I'll take it temporarily, but maybe more than 6 months is not acceptable, right? So you want to think more about the big picture than the little picture, because the little picture can be really complicated, but the big picture, like, what really matters, and I think maybe one good thing to do. So I always think that if you haven't seen the movie or read the book, The Diving Bell and the Butterfly, I think that might be a really good movie to watch, or a really good book to read, to figure out like what you will tolerate. This is a guy who had locked-in syndrome, was able to communicate what he was feeling. So locked-in syndrome is where you're 100% mentally there, but you can't move anything except your eyelids, right? And so I often think, when I think about like, what would I want? Could I live in a situation where I can't move anything but my eyelids? Like that, like, what like that might be it for me. So anything up to that, maybe I'd be willing to live with, right? And I might even be able to live with that, especially with all the streaming services these days, right? There's lots to keep me, and books on tape, which weren't around when he was living his situation, right? So there might be ways that you might still be able to find joy and pleasure in life, even if you're locked in. Yep. Why should you do this? My advice that I got from a nurse a long time ago is that filling out your advance directives could be the last loving act you can do for your loved one, because it removes the decision-making burden from them, right? It allows them to not feel like they're the ones who made a decision to kill you, right? Because that's how surrogates, family members, loved ones often walk away from, when the doctors and nurses come and they say, this is where we are. We don't think they're going to get better. Should we withdraw the ventilator? And that is a really hard call, because people don't want to be the ones to say, I'm the one who said yes. I'm the one that helped mom stop breathe. I'm the one who helped dad stop breathe, right? So if you tell them, I don't want this, please say no to these interventions for me, then you've taken that burden off of them. And it allows them to do what might be their last loving act for you, which is to respect your wishes. But they can't respect them if they don't know what they are, right? So if you're getting to that, if you were in this situation with you, you can do something loving for your loved ones, and they can do something loving for you. Yeah. So Martha says, so I see. So Martha, you're talking about The Diving Bell and the Butterfly. Right. Yeah. I mean, the cost, she says, I hear you, but the cost financially may not be able to be more. Right. Look, and you get to make decisions about the kinds of care you want for all kinds of reasons, including the financial burden that it may present. right? And that's a completely understandable element to this. And, you know, we sometimes get providers who think family members are making decisions because of cost, and it's rarely the case, right? Because Medicaid will pick up things depending on your circumstances, right? Medicare will pick up things depending on your circumstances if you just complete the paperwork. But with that being said, if you don't want your care to be a financial burden on your family, you get to make that call, and you should let people know that that matters to you, you know, that you don't want your house to go to CMS, right? And that's up to you, and that should be respected. But make that clear so that if you just tell your family this is it, and then they go to the team and they're like, well, she didn't want her house to go to CMS, that's going to raise some red flags with people, unfortunately, even if it shouldn't, right? People are going to say, oh, you know, they want her house. Right. Well, maybe they do, probably not. It doesn't really play out that way usually. But if you put it down in writing, then, you know, we can't question it. Yeah. Okay. So here are some links, which I know that Molly sent you a bunch of this. These are the laws if you're the type of person who likes to read these things. And then I put our contact information on here. So when Molly and Lisa asked me to do this, I said I was happy to do it because for those of you not familiar with the Metro Health system up here in Cleveland, Ohio, we're the county hospital, we're the safety net hospital, and we believe in contributing to the community. And so if we can be helpful to community members, whether they're in the Cleveland area or not, we're happy to do so. So if you have questions about this, I put both of my email addresses on here. You should certainly feel free to reach out to me, but that is our phone number there. And any of my staff, some of whom are on here, be like, oh my gosh, she just gave us a lot of extra work, but that's okay. We're happy to answer questions and talk to you. That's what we do. And that's our department or our center email address there. So, oh my gosh, we only have 2 minutes. Where did that time go? Are there any, and I'm happy to stay on. I told Molly and Lisa before this that I'm actually happy to stay on if people have, I know some of you will want to go, but I am happy to stay on until I've answered everybody's questions.
I have a couple of questions if you don't mind. First of all, so I have adult children that each signed a healthcare power of attorney and a living will. They did it when they were living in Ohio. Now all 3 of them live in New York. So how do they need to sign documents for the state of New York, or how does that work?
You know, so we had this question recently at a talk that a couple of my staff were giving the other day. And the answer I would say would technically be no, because they have the Ohio ones. You know, if they like the New York ones better, then maybe they want to fill out the New York ones, right? But I feel that New York, whatever hospital or whatever provider they're seeing in New York should respect their Ohio documents. Okay. But, you know, they might want to take a look, and if they like the New York ones better, then they can fill out the New York ones. You know, because if they come back here to visit and they end up in the hospital here, there's no issue. Right. But if they're in New York and they come back here again, there shouldn't be an issue, but you never know. But I would, again, if you go to a hospital with whatever documents from whatever state and they're valid, and there are no questions about the validity of the document, if somebody won't respect that document, call the legal team, call the ethics team, call the ombudsman, call patient experience. Because you have a right to, you can't have you know, if you spend 6 months of the year in Florida, I mean, or you spend 3 months here you can't have documents from every state, you know, so I think that they ought to be respected, and it's just somebody's sort of lack of knowledge that's interfering with that.
Okay, thank you. And one other quick question. I know that I also filled out an organ donation form, but I'm pretty sure I checked the box at the BMV. So how does that work if my forms aren't exactly the same?
Oh, that's a good question. Anna, so one of my staff is on here who works with somebody in an organ procurement organization. Anna, do you know?
Yeah, I would think if they have the form that they would follow the form, but I guess the question would become if they don't have a copy of the form, they would probably go based on your driver's license.
Okay.
I can actually answer that one. I used to work for.
Oh, okay.
So they're going to look to see whatever the most recent one is. So say, for example, you've marked it on your BMV, but if you fill out the form now and the form is the most recent thing on file, they're going to go by the form.
Okay. Good to know. Thank you.
Mhm. Jan?
Jan?
Monica, this is kind of a long question. I'm the kind of person who likes to bite off one chunk at a time.
Mhm.
And I've been trying to do this for 10 years. And 2 years ago, I finally got a surrogate who would agree. And last year, I think I filled out the POA and I gave it to my hospital, Cleveland Clinic. And then this year I had time. She lives in Florida. So every winter I try to work on this and bite off another chunk because it's just hard to do all this at once. So I talked to her. I had a good solid 15-minute discussion in the car. And I read that The Conversation. Have you seen that? The Conversation.
Mhm.
So I filled that out and I read that to her and I made a file up for me. I put that in there. So it's a basic outline of what I wanted, quality over quantity, et cetera, the basics. And now I'm wondering, well, I was going to see my doctor for that Medicare, that free Medicare checkup this year. And I'm thinking, what should be next on my to-do list? Should I maybe make the top 100 things that could happen to me and then
No.
give my surrogate my answers on all those things?
No,
I have the BMV thing, organ donation. I have no relatives except my brother in Florida, and she's told me that he doesn't want anything to do with this. And she's a doctor and she's willing to do it. So she would come up to Ohio and, take care of me. And she asked me, just tell me what airport to come to and give me the names and addresses and phone numbers of your friends. And she was very businesslike, just like a doctor is. That's why she's good at what she does. So what should I do next?
so Jan, it sounds like if you're overwhelmed, then less is more, right? Because it's better to do something than to do nothing. And if thinking through all of that keeps you from doing anything, then it's not going to be useful. I'd say if you haven't completed the living will form and that you wouldn't want artificial nutrition, hydration, and respiration in the event, right? Then that would be the next form I would fill out.
And I can give, but if she already knows that,
yeah,
that's kind of taken care of. It's just all these possible things that I haven't told her because I don't know.
right. You don't know. So I don't mean to, but that's exactly the point, right? So it's better for her to know what you like to do with your time than it is what medical treatments you would or wouldn't want.
Okay.
Right? Like what are the few things that you just could not live without doing, right? Like, so for me, if I could not have some understanding of my nieces and nephews being around and what's going on in their lives, that would be it for me. And I don't know what that understanding would look like, whether I'd have to be able to see them or hear them or read about them or, whatever, but I need some connection to my nieces and nephews. Otherwise that would be it for me. Right.
Well, the other thing I'd want is the right to die. Like if I had dementia, but we'd have no control over that in Ohio. So
you can voluntarily stop eating and drinking if you want.
I told her that. That's what I intend to do.
Yeah.
Stop eating.
So you can do
So,
that.
Can I ask a question about that, about Jan's wishes? So Jan, if your surrogate, if your power of attorney is in Florida, Monica, I guess my question is, if there's any chance that person really isn't readily available in the moment, then having that living will might be relevant for this area to have that on file here locally.
Okay.
Yeah. And Jan, I know that your brother doesn't want to be involved, but if you've only named one agent, we should have a name of somebody else, whether it's another friend here in Cleveland who we can, who you would trust second, or if it is your brother that you would want. It is good to have a second person because I'll tell you, if you end up at Metro, I'm going to go to great lengths to track down your brother if we can't get a hold of her. But right, any documentation that you can give the Cleveland Clinic or Metro or UH or wherever you think you're, Southwest, wherever you think you're going to go, the better. Because if, we have to make a quote reasonable attempt to get a hold of your agents. And if we can't get a hold of them in a reasonable amount of time, we're going to go look for somebody else. And in the meantime, you're going to have doctors and ethicists and social workers and chaplains making decisions for you. I mean, that's right. Every hospital has a process in place where we have a patient quote without a surrogate, even if it's without a surrogate temporarily. I mean, if it's an emergent issue, then they will just treat you and we'll sort it out later. Right. But if we go on for a period of time and we don't have somebody to contact, then oftentimes these hospitals have committees or something and they weigh in on treatment for you. So it is really important to have we need somebody's name and a phone number and a backup name and phone number.
Yeah.
So it's important really for Jan to make sure her doctor has that, if she can put it on
My
her
doctor
chart.
has my brother's phone number and my sister-in-law, his wife.
Yeah, and it's good
Does
for
he
your
have the surrogate?
Yeah, she's the
Okay.
surrogate.
And you said, did I misunderstand? Or was the Cleveland Clinic your hospital?
Yes.
Okay, then the Cleveland, if your doctor is a Cleveland Clinic doctor, then the Cleveland Clinic will have it. But if you go to a doctor in a private practice who isn't affiliated with one of the 3 big hospitals, like in Cleveland, if you're in Cleveland, then you should get it to a hospital. All you have to do is contact their social work department and you can send it to them and they will upload it to your chart. If you don't have my chart, and don't upload it through my chart. So
I have my chart, and my sister-in-law now has access to my chart.
That's good. That's good. But if you're not in Cleveland and you know what hospital you're likely to go to, if your doctor isn't necessarily affiliated with that hospital, call the social work department and tell them you'd like to give them a copy of your, healthcare power of attorney, live and will, or whatever, and ask them then to scan it into your chart.
Tip. I did not know that they would do something like that.
Yeah, they scanned my power of attorney into my chart. So I'm not putting off doing a lot of things. I'm just purposefully breaking it up into small, doable chunks, which is the way I attack every big project. And it makes everything doable when you just make a goal, one small goal. Even if I'm going on a diet, it's like, okay, I'm doing one thing today or one thing this week, and I'm not going to think about beyond that. And
Sounds like you did the most important thing first. So that was the good thing.
yeah, I knew I had to do that. I still haven't decided whether I want to be cremated or buried, but I don't, my priorities are before I die rather than after I die.
Right. No, you're
I even sort of wrote a will when I was in Florida to my 4 best friends here in Ohio. And I said, here's what I envision after I die, and 2 of them came through and said, sure, I'll do that. And the other 2 said, I don't want to talk about it. So
that can happen.
At least I found that out by approaching the subject, and I'll keep pestering them. So I
did you
got
have
a
a
lot
question?
done. I got a lot done this winter.
Good.
Yeah, when you just mentioned about the conversation, is there like a form, something where they talk about different items to include in the conversation, or you just?
I think you can go online. You could go online and look up the conversation. Am I
It's
right?
called the Conversation Project.
Yeah.
Conversation project.
We
Okay.
included that in the last on the first presentation that Lisa did. I put some tools out there from the
I kept
conversation.
all the links to it, but I haven't.
Yes,
gone-
exactly. Right. You can just
Okay.
look through those at your leisure, and it's a really nice way to get the conversation started or to kind of document what you're looking for. It's a nice way to kind of say, here's what I've been thinking about, and kind of put it in front of somebody in a non-scary way for them to be able to hear the information too.
No, and again, it's, when I talk to people about this, I'm like, these shouldn't be scary conversations because they're not all about death, right? We're all going to be sick. We're all going to end up in a hospital, right? We're all going to be in a situation where we are not able to participate in decisions on our own behalf, even if it's for an hour, right? We're all going to be there. And so it is good for people to say, look, if I get sick, this is what I want you to do. It's not just if I'm near death, this is what I want you to do. Yes, we're all going to be near death too, right? But it's not just about death. So I think, if you have people in your circle who are skittish about talking about your dying, which is understandable, right? Then don't talk about your dying to start, talk about your being sick. And again, even if it's temporarily, right? So I think she's left. We can talk about her a little bit, that we had a colleague recently in the hospital with an appendicitis. And, you know, like, who knew, right? Who knew that you could be so out of it with an appendicitis? You can be pretty out of it with an appendicitis, right? And so if you get an appendicitis, you want to know who's going to participate in the conversations with the doctor on your behalf, because it can be pretty painful and you can be pretty distracted by the pain and the medication you're on while, you know, you have to make informed decisions about the surgery. So even something what seems as innocent as an appendicitis could lead you to need your healthcare power of attorney to be involved in your medical care. Right. So it doesn't have to be the big catastrophic, you know, hit by a car, traumatic brain injury, whatever you might have in mind. It could be something as what we think of as simple as an appendicitis, a gallbladder flare up, right? Pancreatitis, right? Any of these things that are, you know, generally recoverable, but could put you in a position where you can't participate because of pain, because of medication, what have you. Right? Because of being overwhelmed, you've never been sick before. Now here, all of a sudden you're sick. And now what are you going to do? You know, I mean, all these things can lead to you're just not being able to think through the situation you're in, and you may need help.
That's helpful, because whenever I start talking to my daughter about whatever, and she just like, yeah, and she said, Mom, really? But that would be helpful, because I know how well my mother had put everything together for us. And every time we came home, it was, this is the file. And then finally the day came and we knew exactly where everything was. So I get that benefit. I guess the other thing that I was looking at, I touched on a little bit last time as well, was that, you know, again, so what I'm understanding tonight with on the driver's license, when you have set that for the organ thing, it's everything. So I don't need a separate form for donating to school or to education or anything like that. And then how does it get communicated in terms of, I forget whoever you called that gets in touch with the family, then they would discuss about getting the ashes back or whatever.
Yes.
And it could, from what I understand, it could be a year or longer.
Yes.
But
Yeah, if you though want to donate like your body to a school or something, and you have a particular school in mind, you should contact the school and see what the school's process is to make sure that it goes to that particular school. And not, you know, if it matters to you, right?
Yeah. Sue, did you get the email I sent you? I sent you a list of Ohio schools.
Not
If
that
you
I
did
saw.
not, okay,
look
I will
at-
go and I will resend that just to make sure you have it. Might have gone into your spam folder because we don't really email each other very much, but
Okay,
I will resend that to you because I was able to find a list of all Ohio body donation.
oh, great.
Yeah.
Oh,
And I did kind of say, so last week we kind of talked about this and I did kind of say, you know, generally you're supposed to you're still supposed to like notify the school. And then I told her when we had organ and tissue donation cases, usually we would call the medical school and say, hey, this person's eligible for donation as well. Can they be a donor? And then your family generally would say, well, you know, if it means they can't donate their body, then we prefer to not do organ donation. And then usually the organ donation organization is, you know, is fine with that because they realize that, you know, sometimes body donation needs to take precedence depending on what can be donated for organs. So
Is there any reasons not to do it? I mean, I guess I don't understand why some people don't, or, I mean, is it well,
Some people are just,
but spiritually, or, I mean,
it's a preference. So some people are, you know, think to themselves, yes, I want my organs to go to somebody to help them live.
right.
Don't really want them scraping off my tissue, like my skin. I don't, you know, because, and even though that'll go to burn patients and be very helpful to burn patients, right?
Yeah.
They just think like scraping my skin is icky, or putting my body on a table for a bunch of medical students to cut open creeps people out sometimes, right? They just don't want that whole thing.
Yeah.
So, and, you know, they don't want their organs going for research because they are like, well, where is my DNA going to end up if I do that? You know, so people have lots of questions.
Oh,
And
That's-
want to be very specific. And, you know, some people have concerns like they don't want to donate their eyes. That pushes, you know, they're okay with the heart, but not okay with the eyes, you know, so
Okay.
people just it's just preferences, you know?
Well, that helps, and knowing the last thing is the my chart thing, that because my doctors, my internists, like a lot of us, they keep changing. You know, and they're gone, and then you change again, and I'm like, well, when Jan, you said that your doctor hasn't, and I'm like, but my doctor keeps changing, so as long as I have it downloaded into the my chart, then I don't have to be so concerned about her knowing.
Right.
Right.
Okay.
Can I mention something?
Mhm.
I just heard recently that nobody's going to want my 76-year-old parts, which is a real disappointment because I thought, you know, if you don't accomplish anything in life, at least you can leave your parts to help people after death. Is that true?
No, not necessarily. What they'll do is they'll do a full evaluation at the time of your death. And they'll evaluate, there could, you know, if you're okay with research and things like that, there could be different research studies going on. My 65-year-old sister just died this past year, and she was a tissue donor. And we allowed it to be for whatever was needed. Depends. Sometimes if the eye bank or eye places are doing certain research, sometimes even if you say you want to donate your eyes, they'll be like, well, we don't really need them, and we're not doing research on this particular person who has a condition. So they may not take it. So it's just, again, one of those things, again, what you're comfortable with. Some people have concerns about tissue donation and open casket viewings, and those are conversations to have. So those are the things that, you know, you can be a little specific about. I used to say, if it's in your heart, it should be on your license, and let somebody figure it out if and when the time comes.
Oh, I mean, my husband died at 46 suddenly of a heart attack at the Denver airport, and the police, Shaker police, came to the door, and that was after they had me settle down, that I had to go in the kitchen and they asked, and my husband had never put it down on his thing, and I'm such a strong believer, but it was like,
Yeah.
and then I didn't know where his family stood on it or anything, and finally I said, I guess you can't, but it was just like, that's always been like, oh, shoot, I wish he had taken care of that, so it's.
Right.
Yeah.
Even if he'd have just said something when you were watching TV one time, you know what I mean? Or
Yeah,
something.
well,
We
I'd
used to
ask
have
him,
that
and
a
he
lot.
said, I haven't decided yet.
Yeah.
And also
It's not a-
specific reasons. So for, you had mentioned Lewy body disease, you know, some people donate their brain, you know, for those purposes to be studied. So there's more reasons we can even think of. And really quickly, I always have to give Bill Gupton a shout out because there is the option for green burial in, I think, parts of Ohio. He's in the Cincinnati area. So, you know, that's a whole other topic, but I just thought I would mention, there's Bill. I knew he would hopefully jump in there.
Yeah.
We don't need a whole, you know, we can have a whole other discussion on that, but I just thought I'd give you the opportunity.
Yes, so natural burial or green burial, there are several places around the state where that is possible, and including the one that I operate here in Cincinnati. And that's a we call it donate your body to nature. It's another, that's a way to think of it. You're donating your body back to the earth in a way that's not possible with a concrete vault and a metal casket and all those kinds of things in a conventional cemetery.
Thank you. Bill, maybe we can talk to you later about a whole different discussion.
Sure.
Anybody else? This has been such a great discussion, Monica. We really just, again, can't thank you enough.
Oh, thanks for having me, letting me share this experience, right? It's just not helpful if I don't get to share it with people.
Right.
So I appreciate being able to share it.
Tom, did you have a question? before we-
I did have a real quick question, given that the natural burial came up. And Bill, I need to get a hold of you because I'm in Westchester. But my question is, like on my DMVs, I mean, they can do whatever they want with whatever they can use. So if you have arrangements for a natural burial and they take whatever they can use, then how does that how does the logistics of that work? Will they then follow your directives for your natural disposition after they are completed with whatever they're going to do?
Well, this could get really complicated in terms of because they have really opened the body up. It would not be complicated if post donation you were cremated,
Right.
but if
They will always do a full reconstruction. They'll do a reconstruction even if you don't ask for it. So if you have bone, like long bone donated, they're going to use a prosthetic and they will, now that could be an issue because depending on what the prosthetic is when
Exactly.
it comes in terms of natural burial.
the reconstruction stuff's not going to be at all, natural or biodegradable.
Right. So that's a consideration.
Right. But if it's a post harvesting cremation, then certainly there can be a natural burial. If you want what body parts remain to have a body natural burial, it could get complicated.
So let me ask just this, and I will be done. Bill, are you with an organization in Cincinnati?
Yep. Yep. So it's Heritage Acres. So Google Heritage Acres.
I've been on the site. I thought that was it.
Okay.
I will get in touch with you. Thank you.
Okay.
Is that something that would interest you guys to do something about green burial? Do we have aquamation in Ohio, Bill?
Unfortunately, aquamation is not currently legal in Ohio.
Okay.
And there's a long and interesting story about why, because some were done and then it got blocked.
Okay.
But yes, I mean, was your question just
I didn't
about
know how many more different alternatives there were besides like the
Okay.
green barrel. I know I've heard of aquamation.
aquamation is not yet available in Ohio, nor is composting.
Okay.
I'm interested in green burial. If there's anything in northern Ohio,
Yes, there's a place called Foxfield Preserve. Kind of near, what is that college up there? Worcester, kind of near Worcester.
that's my hometown.
Okay, so Foxfield Preserve, well, it's at the Wilderness Center in Wilmot. If that's a familiar place to you.
Oh, okay.
But yeah, I would look up Foxfield Preserve. That was the first green burial ground in Ohio.
I thought they did have composting there, unless I'm thinking of a different website.
Well, I'm talking about natural organic reduction, which is an actual process that's literally reduces the body to compost within a month or so. And that's legal in a few states, but not Ohio yet.
I would assume that if you're planning your funeral and all, that's who would take care of all of this, of the funeral home.
Yes, but for a green burial, you need to get the right funeral home. You need to get connected to the right funeral home, which you would do that through Foxfield. I would ask them what funeral home they use and recommend, because most funeral homes will not be up to speed on green burial at all.
We'd be
Thank you.
to work with Bill and get a program for you guys
Yeah.
together. If you'd be interested in learning more about that, we can sure do
Yeah.
that.
You'd be interested in giving one, Bill?
Oh, yeah. Oh, yeah.
Yes, Bill, sorry, I didn't even ask you if you'd be interested.
I just threw you in there because I think it's,
Well, because you also sort of knew I'm a natural burial evangelist, so.
Yes, you
fine.
are. So,
so back to Monica, we truly, this has just been fantastic.
Wonderful. Thank you so much.
Yeah.
thank you so much.
And we're going to
Okay.
give a shout out really quickly to the S. Livingston Mather Charitable Trust that gave us a grant to make this type of presentation possible. So we thank you all. Thank you for coming.
So
Thank you.
next week will be more of a work session. If you want to bring some of your documents, if you have more questions, we'll get some more links together. If I don't know I will be kind of heading that next week. If I don't know the answer, I will find them out for you. So as you've kind of processed now, those who attended last week and you're attending this week, kind of putting it all together. we're just going to be online from 7 to 8. I'll kind of help you. Like Jan, you said, it kind of gets overwhelming. My job is organization. I love nothing more than a plan, and an easy streamlined plan. So that's kind of my jam. And I will be able to help you guys take that next step and kind of say, okay, here's what I'm going to do next. Here's who I'm going to share it with. And we'll get you started to kind of take this all and run off on your own and be able to share your wishes and have them documented.
And we can get copies of this recording and
You are
last,
going to get a copy of this
and
one
last
and the
week-
last one.
okay, because
and
I
all
have
the
a friend
links.
who wants them too.
Okay.
Okay,
And the links, is it the ones that you had provided, since I haven't gotten through all of them? I'm looking at the most streamlined way to get at being prepared for next week. Is it better to just go onto my chart and fill out the forms from there, or are they the same forms that have you?
Monica, can you answer that? I'm not really sure.
So I would use the links and the forms that Molly sent, because they're the Ohio ones, they're the standard ones. And I would hope that my chart has the right ones on there. I didn't know that my chart actually has them on there. So I would fill them out here and then upload them to my chart when you're done with them here. Just because, again, they're standard, they're the ones people are going to recognize. And that way there's no confusion, because sometimes we get these ones and you just,
Yeah.
why, I know someone tried to make it easy on us, but now it's not. So I would use the links, the copies that Molly sent, because those are like the Ohio Hospital Association versions of these forms. So the state of Ohio has a law about this, about all of these, but except for the DNR order, they don't create the forms, so to speak. So the forms are created based on what the law says.
Oh,
So that's why you can have different ones that are supposed to be at least consistent with the law. But people, again, fudge them and say different things. Like we've had some lawyers combine the financial power of attorney with the healthcare power of attorney. The language is in there, like it's like a paragraph about the healthcare power of attorney, and then we're trying to sort out, and people got confused and completed a healthcare power of attorney independently, so it can just be kind of a mess. So if you just use the ones that Molly sent, those are like the Ohio Hospital Association versions of these forms. Most of them, like the Declaration for Mental Health Treatment, is not an Ohio Hospital Association form, but it's the standard Ohio version, right? And then the disposition of body form, I found one that was like considered to be the quote Ohio version, right? So the ones that I sent Molly and the ones that she sent you are considered the standard versions. And so that's why I'd encourage you to fill those out.
yeah, maybe I'm wrong on my chart. I thought they had a thing about, check this and then it would take you to the pages that.
It might be, but like the Cleveland Clinic, I think, has their own versions up there or something, right? And I trust the Cleveland Clinic, and it's a great hospital, and I did my fellowship there, and it's all wonderful. But, people will tweak it so they can have their name on it, or they can make it their own in some way, and it's like, oh, let's just not do that.
Okay.
Can I say the Cleveland Clinic scanned my forms
Right.
into my chart?
Yeah, but I have one set there already, but it was done
Okay.
about 10 years ago. So now it's like, okay.
Yeah.
Updating, and I haven't even looked at them for a while, so.
Yeah,
okay.
the links I sent you, there's a lot of explanation parts around them, but if you want to come prepared next week, print off the parts that have to be signed, do your reading. And again, whatever I don't know the answers to, I'm sure Monica will graciously allow me to write these all down and ask her, and we can certainly get them back to you. But I know sometimes it's about finding that time to sit down and do it, because it is overwhelming. So hopefully next week, our work session is just an informal opportunity to do that.
Okay. Thank
Okay.
you so much. Wow.
Fantastic. Well, thank you all so much for coming. Now we're 8:30 right on the button. So I'm going to let everybody go. Monica, we cannot thank you enough.
Thank you.
It was just
Thank
so
you.
informative and excellent. I just want to send this out to everyone I know and have them watch it.
Yes.
Because I learned new things, and I also learned some great opportunities and tips that we can make sure that our other supporters have. So thank you so much for your time, and thank you all for joining us tonight. We
Thank you.
appreciate it.
Bye.
Bye.
Have a good one. Bye-bye.